have a busy schedule. The first part is you're going to have to listen to me a little bit, but I'm going to have you up and moving too. The second part is Rob Schmidt is coming, and then we have Ben Cole also coming today to speak with us. The first part, we're going to do a modified version of hearing distressing voices. So what that means is we're going to watch a video, just a 20-minute video, to kind of get the background of what hearing distressing voices is. In the meantime, while the video is going, I'm going to pass around a consent form, because when we do this exercise, we want to make sure everybody feels okay, everybody's safe. There is a risk that if you've had previous experiences with any kind of hallucinations or, hearing voices, we want to make sure you're okay, because what we're going to do is you'll have a fancy MP3 player that we will ask for back, I know. Very high tech. And you'll have your own earphones, which you get to keep these. We really don't want that. They're nice just to throw in your purse in case you need an extra pair, or you can throw them in the trash if you want to. I find them helpful to keep in my purse in case the kids need them, and I don't want to listen to their iPods or whatever they're playing. So what we'll do is you will listen to what it's like to hear voices. And during that time, we'll have you do different exercises. The one thing we do say is, if it becomes too bothersome and you don't want to take them off or you don't want to say anything, just turn the volume down. If they're not bothering you, we encourage you to keep the volume up. We encourage you not to stop it, because we want you to get the full effect. Again, this is going to be a modified version. Usually we do it in like 3 hours. And we do quite a few different activities. Luckily, we have a beautiful day, so some of the activities will be for you to go outside. Jessica Chase will be my helper, so we'll have people out there just watching and making sure. Another one, you'll be given activities where we'll actually be talking with you and having you do exercises. So we're going to go ahead and get started. Again, please feel free, if it gets to be too much, just turn the volume down. If you don't want to participate, we're not forcing you to participate, because we don't want anybody to feel uncomfortable or put anybody back up. Okay? So we're going to go ahead and get started with the video. And sorry, it's not the most exciting video, but I think it gives you a really good background to how this was created and why this was created. And when we're done, we'll come back and talk about what you experienced.
Workers with a longer-term relationship with a person who hears distressing voices really have a unique opportunity to engage with voice hearers. And interestingly, one of the most frequently cited problems in mental health services that voice hearers cite is an unwillingness of mental health workers to engage with them in a meaningful way around their voice hearing experience. There tends to be in the culture of mental health sort of a clinical tradition of let's not talk to people too much about their voice hearing experience, because it might reinforce the experience somehow in a negative way. And what, in effect, that unwritten policy ends up doing is leaving those of us who hear distressing voices isolated and alone with that experience. And when you think about the fact that someone might be hearing distressing voices 15, 25, 60% of their waking hours, that's a lot of time to be left alone and to be left isolated. And so it is very important for workers with a long-term relationship to feel that they can help a person break out of the isolation of the voice hearing experience by engaging folks around this. Now, there are certain don't do's. Do not get into interpreting the person's voices for them. Do not get into playing junior psychoanalyst and beginning to try to figure out the symbology of what the voices are saying. If you're not a psychotherapist, do not attempt to analyze the voices and trace them to childhood trauma or whatever we might be learning at school, okay? But there are certain simple ways of engaging with people that can be constructive, and I want to go over a few of those with you now. First of all, your attitude. Listen and don't be judgmental, okay? Do you empathize? So if a person's telling you some of those humiliating things about the voices calling you a whore, they say I'm an idiot, express that that must be difficult and show some empathy around that. Be curious. I think curiosity is perhaps the most important tool and orientation that a mental health worker can have. We should never get bored in this work. It's extraordinary work. Each individual we work with is different. Curiosity. So begin to ask about the phenomenology of the voices. The things we talked about earlier. Are there one voice, two voices? How many? Do they have a gender? Are they male, female? Do you know them? Don't you know them? When did you start? You'll probably be surprised to find that most people's voice hearing experience started after some traumatic event, a car accident, the breakup of an important relationship, the loss of a loved one. It's not at all unusual. Very importantly, ask people when they hear voices and when they don't hear voices. It's important to know when a person is not hearing voices, and then to think about, gee, how can we maximize those periods of time and minimize the number of times that a person is hearing them. Most importantly, research has shown that people, in order to be able to successfully learn to cope with voices, need first of all to develop some kind of coherent understanding or attribute some meaning to the voice hearing experience, okay? And what meaning and understanding you develop is not as important as the fact that you develop one, okay? So some people develop an understanding that their voice hearing experience is reflective of a biological brain disorder, okay? And that understanding then allows the individual to begin to think about that experience, communicate that experience, and do something about it. Other people will develop other types of understanding. So, for instance, a person might begin to develop an understanding that my voices start up when I'm under a certain kind of stress. My voices act, if you will, like a red flag, saying, alert, alert, pay attention to your life. In other words, the voices become a red flag that points to something I need to attend to in my life. That would be an example of another type of understanding that a person might develop. A person might develop psychic or spiritual understanding of what their voice hearing experience is about, but what's important is that they develop some sort of understanding. I'm going to, at the end of the video, be putting up some slides. At the end of this talk, I'm going to put up some slides with some resources that explain a whole lot more about how various people understand their voice hearing experiences, and making these resources available for the people you work with. These books, these email lists can really be of help. Helping to connect the person who's a voice hearer with other voice hearers can break that isolation and really begin a person on the road to wellness. There are also important coping strategies that we can, as mental health workers, begin to help our clients develop. The advice to just tell the voices to shut up is about the worst advice you can give somebody. So let's avoid that one. In fact, we find that getting angry at voices, it seems to just feed the voices and make them that much more intense. There's a difference, of course, between getting really angry at your voices or telling them to shut up in an angry tone and getting assertive with voices. Learning to get assertive with voices is actually a powerful strategy that's been developed by voice hearers and is also understood by cognitive behavioral psychologists. So, for instance, when you begin to hear distressing voices and then to out loud say stop and make some sort of physical gesture, stomp your foot, pound the table, stop, and then immediately begin to think a pleasant thought, is actually a well-established way of beginning to diminish and even rid oneself of distressing voices. And so it's important for a worker then to help an individual, okay, what's the pleasant thought? And let's practice. You know, persons tend to sometimes be very timid. So learning to get a strong stop, followed by a bodily gesture, followed by a pleasant thought, and practice that with good results very often. It's a very concrete way to help people. We've already talked about listening to headphones. Listening to headphones is a very effective strategy that has been studied by researchers and it does work for many people. Now, it's important to recognize it's not just how loud you play the music. It's not that the music drowns out the voices. What happens is that the music helps us turn our attention from what the voices are saying to what's on the music, the rhythm, the lyrics, And so it's that the person is interested in what they're hearing. So if you're working with someone who's using headphones, inquire about it. What does it do? How does it help? Does it take them away completely for a little while, or does it just diminish them and get your attention off of them? But that's a sign of human resilience. And we should really be sort of encouraging a person and noting that strength, as opposed to just seeing people walking around hearing headphones, listening to headphones. Research has shown that using your own voice, vocalizing, whether that be reading out loud to yourself from a Bible or from a book that you're reading right now, or just singing humming a little song under your breath, can actually help with distressing voices to diminish them. Another technique that's used by some people is called aversion self-therapy. Basically, in this technique, maybe you take a rubber band, and every time the voices start up, you just pop yourself with the rubber band. What it does, on one hand, is it really does for a moment break the spell of the voices and get your attention on, ouch, that hurt. And people can learn to use that technique. And it's remarkable. I've had some people that I've worked with in coping with voices workshops for whom this technique has become a mainstay in their wellness toolkit. One technique that I use and many other people use to cope with distressing voices is to make a tape of people saying nice things about me. And I found it difficult to think a lot of nice things about myself. And because my voices tended to say some very awful things about me, I went around and asked people that I knew, who I was sure would say some nice things about me, to speak into a tape recorder. And when the voices would start up, I would put my headphones on and listen to a tape of people saying very nice things about me that helped to offset some of the negativity of the voices and to remind me of my own worth. It's important to remember that using medications can also be an important tool in our recovery and wellness toolbox. That medications, as we mentioned earlier, can help a person feel more on top of and more in control of the voice hearing experience, even if it doesn't entirely take the voices away. And so that helping a person express their concern about their voices to their psychiatrist or to the prescribing nurse can be a very important role for the support worker or the mental health worker in helping someone use that particular coping strategy. Many people find that by either increasing or decreasing personal contact with other people, interpersonal contact, that can really help. So sometimes if you're getting too overwhelmed by being around too many people, going and being quiet for a little period of time can help. If you've been alone too long, your voices might be getting bad. That might be a signal it's time to get around people. So simply telling people to watch and to what happens to voice hearing when you're around people too long, and to learn the limits around being around people, but also to learn the limits around being alone, and finding the right balance for the individual. Physical exercise is a very important coping strategy for many people who hear distressing voices. And physical exercise doesn't have to be going to the gym and doing, heavy duty aerobics. It can be something as simple as going out for a walk. And in fact, a lot of clients that you work with already do walk. And that can be, again, seen as a resourceful, resilient person doing something to help them out, themselves out with the distressing voices. So exercise can surely help. We've already talked about the importance of distraction, and that's really the hallmark of all these coping strategies, is that getting distracted from what the voices are saying, sometimes by reading, sometimes by focusing on a TV show that you particularly like. Sometimes what works for distraction is simply, if you're sitting on the couch in a warm apartment, stand up and go into the brisk cold air. If you live in the desert, just get out of your air conditioning and get out into the warmth. If you're sitting there and you start to hear voices, go get into a cold shower. The cold water hitting your body will, for at least a split second, get your mind off the voices and into that experience of being told. Anything that disrupts the tedium and monotony of the voices can really help. One technique that I know I used in my recovery at a certain point when I was involved with a therapist, and I do advise using this technique in a peer support context or with a therapist, is treating certain voices as your own thoughts. So, for instance, if voices are saying something terribly negative about you, and we might sit there and say to my therapist, well, the voices say I'm no good. The voices say I'm worthless. With the help of a therapist, to learn to be able to say, no, sometimes I think I'm no good. Sometimes I think I'm worthless. And then to begin to deal with that, by going through that, it's a very difficult thing to do. Let me just preface it and say that. It's very hard to do. But with the right support and a skilled therapist, you can do it. As you begin to own the thoughts, the voices of your own thoughts, then very often the voices do diminish. It can be very helpful sometimes to keep a log of when you hear voices and when you don't hear voices. And sometimes you'll notice a pattern. Oh, I only hear voices when I'm around certain people that make me nervous or that make me upset. Or, oh, I only hear voices at night when I'm walking alone on the street when I'm fearful. And noticing these patterns can help us avoid the situations where we hear voices, and this can be very helpful. Practicing challenging what the voices are saying can be very helpful. So if the voices are saying that you have a tumor growing in your chest, you can challenge that. Prove it. Prove it. And it's very helpful sometimes to do this with a peer or with a worker or a friend.
Yep. We're getting there. I forgot to state.